monitoring COVID-19 has many angles. One is just to simply record how many infections are occurring in patients with hematologic malignancies. The other one is to record what is the anti-spike response to vaccination. And the third one is what is the ability of T cells to respond. And I'll get to those in order. Of course, monitoring infections in patients is important because what we want to know is, are patients with hematologic malignancies and Waldenström's in particular, and we have about 400 of those patients that we're monitoring, what is the rate of infection in those patients? Is it higher than the normal population? And beyond that, are those patients who are getting COVID infections, are they longer infections? Are they more severe infections? And are they winding up in the hospital? And furthermore, are they dying of infections? And how does that compare with the general population? What I can say, we have recently conducted a survey of the breakthrough infections after either vaccination or Evusheld. And for those of the audience who don't know, Evusheld is a monoclonal antibody cocktail consisting of two antibodies, which is designed to prevent infection. So it's used before people actually get an infection. And so we've been monitoring breakthrough infections either after vaccinations, after Evusheld, or both. During the period of the Omicron surge, which in the U.S. happened around January, and now post-Omicron surge, which took place somewhere between, in our survey, April to July. So what we found is that, first of all, people who are vaccinated can get breakthrough infections. So, for example, during the January period, about 10% of all patients got breakthrough infections. And we are now, and the data is still preliminary, but we're analyzing this right now, that the breakthrough infections that occur between April and July are also they're about 15%. Furthermore, we're seeing breakthroughs on patients who had Evusheld. In other words, even though they've got the preventive the antibody cocktail, they're still getting breakthrough infections. So what does this all mean? This means that patients can get vaccinated, they can get Evusheld, but they're not fully protected. And we believe that in the immunocompromised patient population, like those who have Waldenström's, and I'll get to that in a moment, remain at risk of getting an infection. The good news is that among the 3,000 people that we analyze, including the 400 Waldenström's, we're seeing very few hospitalizations reported.